Good morning. Will you please say your first and last name and spell your last name for the record?
My name is Dr. Jennifer Nora. I was working as an associate medical examiner with the District 9 Medical Examiner's Office in Orlando, Florida. We review all the investigation information that we get from law enforcement, from our own forensic investigators, and then we use that to determine whether an autopsy will be conducted on the deceased individual that comes to the ME's office. We do the autopsy in order to determine the cause and the manner of death.
Can you explain to the jury the process of conducting an autopsy?
So once the deceased individual comes to the ME's office, they'll go ahead and weigh the individual. I will start out by doing what we call an external examination. So we look at the outside of the body. I'll document any kind of identifying features. I will also document any kind of external trauma that they may have, as well as any medical intervention. And after the external examination is done, I will do what we call the internal examination with the classic Y incision on the chest to expose the chest and abdomen. I'll look at all the organs. Also look for any evidence of disease, as well as document any kind of trauma inside the body.
During your almost 16 years, about how many autopsies would you say you have performed?
Approximately 4,500 autopsies.
During your career, have you examined or performed autopsies on remains that have already began the process of decomposing?
Yes, I have. As some of you know, as the body decays or starts breaking down, autolysis, where your cells start breaking down, then the body, because of the gas production from the bacteria that's normally in your gut, also from the cells breaking down, producing gas, the body becomes bloated. You could have like a green, purple discoloration of the skin. And then over time, the body, including the skin, will start breaking down even further, becomes more liquefied, and becomes pretty much soft and mushy. And then finally, over a period of months to even years, the body becomes more skeletonized.
As a body decomposes, do signs of injury become harder to identify?
Depending on how far along they are in the decomposition process, it unfortunately does affect what a wound looks like. For example, like a gunshot wound, which on a person who's recently deceased may be nice and round. As they decompose, the skin becomes less taut. It's just a lot softer. So as I'm examining the wound, the opening of the wound may look more exaggerated and not as well pronounced as in someone who's not decomposed. So it makes it a little bit more challenging.
In this particular case, did you receive 4 sets of human remains that you performed autopsies on?
Yes, I did.
During the course of the autopsy, were photographs taken?
Throughout the process of the autopsy, we took multiple photographs.
Would utilizing these photographs aid your ability to be able to testify about the wounds and injuries that you observed?
Yes, they will.
Your Honor, at this time, the state would seek to introduce into evidence what's been marked State's Composite U, and the evidence is State's 32. Did you perform an autopsy on somebody identified to you as Zoe Todt?
Yes, I did.
What was the condition of Zoe's body?
Zoe, along with the other 3 members of her family, she was decomposed. She was a little bit more decomposed than the rest of the family members. I noticed that more than her mother and her 2 brothers, she was wrapped with more blankets and kind of swaddled a little bit more, so that would have pretty much held in the heat of her body as she was decomposing more.
What was the height of Zoe's body when you received it?
Zoe, she was a little bit more than 3 feet. I would say she was approximately 3 feet 4 inches.
What was her weight when you received her?
She was approximately 30 pounds.
Is this anatomically consistent with a 4-year-old?
For the most part, yes.
Did anything about the condition of Zoe's body affect your autopsy in this case?
As I mentioned, she seemed a little bit more decomposed than the other members of the family. And as I was performing our autopsy, after I did the Y incision and was looking at all the internal organs, I noticed that like the flesh between her ribs, everything almost seemed like, I hate to say that, it was kind of like melting off. the bone. It's just she was just really starting to go, really decompose. But I was able to see that, at least on the outside of her body, she did not have any evidence of injury.
During the course of the autopsy, were samples collected in order to send to a lab for toxicology analysis?
Yes, we did take samples for toxicology. So normally in deceased individuals, every patient will get their blood drawn, and we send that off to the laboratory to test for any evidence of drugs, medications, alcohol. That's just routine protocol. Unfortunately for Zoe and also the other members of her family, because of the state of decomposition, there was no blood available to test. So we asked the laboratory what specimens that they prefer, that they think would be most accurate to determine, to get drug results. So they recommended we take samples of the liver and the brain, and if there was any chest fluid, which is pretty much like decomposition fluid in the body, to go ahead and submit that as well.
Were you able, after performing the autopsy on Zoe, to form an opinion as to the cause of death?
The cause of death was homicidal violence of unspecified means in association with diphenhydramine toxicity. And diphenhydramine is another name for Benadryl.
Were you able to make any determination as to whether Zoe had been smothered?
Based on the autopsy and with the degree of decomposition and discoloration of her skin, no, I was not able to determine that she had been smothered. So if someone was not decomposed and their skin's intact and not discolored, many times we would see petechial hemorrhages, these little red dot hemorrhages in the whites of their eyes or in their conjunctiva around the eyes, as well as on the skin of the face. Sometimes we could see bruising or a cut on the inside of the lips as well.
Did you look for these types of injuries?
I still did the best I could to examine and look for these injuries.
Was the state of Zoe's body affecting your ability to determine whether these injuries were present?
Yes.
Did you do anything with Zoe's fingernails?
On all cases that are suspicious or potential homicide cases, we will take fingernail clippings and or scrapings on everybody.
Is that DNA card the DNA card that was prepared for Zoe's remains in this case?
Yes.
Does state's EE contain the fingernail clippings that were taken from Zoe in this particular case?
Yes, they do.
E as an echo will be received as states 34.
Did you also perform an autopsy on somebody identified to you as Alexander Todt?
Yes, I did.
What was the condition of Alex's body?
So Alex, he was the 13-year-old boy, and he too was in a state of decomposition.
Were you able to get a height and weight for Alex's body?
Yes, Alexander, he was approximately 5'1" and 88 pounds.
Did the condition of Alex's body affect your ability to conduct his autopsy?
Given the state of decomposition, it just made it a little bit more challenging to examine the wounds that he had.
On Alex's body, did you observe any external wounds that you made note of?
Yes, Alex had a single stab wound on the abdomen.
Can you describe the wound that you observed on Alex's abdomen?
Sure, he had a single stab wound on the abdomen. Okay, so this is showing just the abdomen. For orientation, his head was up here, feet are down here. You can see what's protruding through the stab wound is a segment of bowel, and that's because of the gas production inside the bowel and bloating that he had as a result of decomposition. So again, his head is up here. You can see all the skin discoloration, skin slip, there's some maggots. Further down here on the abdomen is where the stab wound was. We wanted to, kind of tuck the bowel in just so I could see what the stab wound itself looked like. So once we cleaned up the wound as best we could, you could see this is the stab wound here on his abdomen. So the wound on Alex probed at least 4.5 inches deep into the abdominal cavity. It sliced through his left eighth rib on the front of his chest, but other than that, it did not hit any vital organs, didn't hit the bowel, and there was no hemorrhage inside his abdominal cavity.
What does that indicate to you, the fact that there was no hemorrhage in the abdominal cavity?
So even in someone that's decomposed, if I don't see any evidence of blood or hemorrhage, to me, it shows that this stab wound was inflicted pretty much post-mortem after he was already deceased.
Is it possible for a stabbing to occur prior to Alec becoming deceased and there be no hemorrhaging?
It's unlikely. There's what we call perimortem, which he pretty much is unconscious, pretty much dead. And even if you were stabbed at that point, you really wouldn't see much in terms of any blood or hemorrhage.
Absent any other circumstances, is that stab wound a fatal wound?
It is not.
Did you also collect samples from Alec for toxicology?
Yes, we did.
Where did you collect the samples from?
So again, on Alex, we got liver tissue, brain tissue, and I believe if he had any chest fluid, we submitted that as well.
During your examination of the liver, did you notice any necrosis or anything like that?
On the liver itself, no.
And what would necrosis be? What would that be?
So when we see necrosis, that means the liver's breaking down, usually before they die, like there's something wrong. So I did not see any evidence of that with the naked eye, just looking at his liver itself. I did take samples to look under the microscope, and there was no evidence of any necrosis at that time. Cause of death for Alex was homicidal violence of unspecified means in association with a diphenhydramine toxicity.
Were you able to rule out smothering in Alec's case?
No, I was not.
Why?
For the same reason as for his younger sister Zoe, there was all that discoloration in the skin. There's no way I was able to see any particular hemorrhages on him.
Did you also collect a DNA card from Alec Todt?
Yes, we did.
Did you also perform an autopsy on somebody identified to you as Tyler Todt?
Yes, I did.
What was the condition of Tyler's body?
Tyler was the 11-year-old boy, and he too was in a state of decomposition. Tyler, at the time of examination, was approximately 4'9" and approximately 84 pounds.
Did the condition of Tyler's body affect your ability to conduct the autopsy in this case?
As for the other two siblings, it did make it a little bit challenging when I was examining the wound on his body.
So during your autopsy, you did observe a wound on the external portion of Tyler's body?
Yes, I did. So we can see his head up here. He's markedly discolored. Here on his abdominal region, maybe a little bit hard to appreciate, but he does have like several segments of his intestines that are outside of the body due to decomposition coming out of a single stab wound. So this is once I was able to, again, tuck the bowel back in, clean the wound up a little bit just so I could see the stab wound better. And we're looking again on his abdomen, and he's got a single stab wound there. He did have a defect or a cut wound from the knife in the large intestine, but there was no evidence of any blood or hemorrhage inside the abdominal cavity.
Absent the other circumstances, would this stab wound have been fatal?
No.
Did you also collect samples to send off for toxicology?
Yes, we did.
Were those samples also from the brain and the liver in this case?
Yes, they were.
I believe you mentioned chest fluid before.
Yes, if it was available, we submitted that as well.
Were you able to form an opinion as to the cause of death for Tyler?
Yes.
What was it?
The cause of death was homicidal violence of unspecified means in association with diphenhydramine toxicity.
Were you able to rule out smothering in Tyler's case?
No, I was not.
Did you form an opinion as to the manner of death for Tyler?
Yes.
What was it?
The manner of death was homicide.
And finally, was an autopsy performed on somebody identified to you as Megan Todt?
Yes.
What was the condition of Mrs. Todt's body?
Megan Todt was a 42-year-old mother. She too was in a state of decomposition.
What was Megan's height and weight?
Megan was approximately 5'3" and about 103 pounds.
Did the condition of Megan's body affect your ability to perform her autopsy?
Just like the other two children who had stab wounds, it made it a little bit more challenging. She too had injury to her abdomen. There were 2 stab wounds. Again, she is decomposed, and with the skin discoloration, it's a little bit hard to see one of them. So you see one right here on the abdomen, and the other one is about 3/4 inches away. Neither of these stab wounds hit any of the organs. This is a close-up view of one of the stab wounds on her abdomen. When I did the internal examination, I followed the path of the stab wounds, was going in a what we call front to back and in a downward direction. That's something that could be sustained if someone were stabbing themselves or if they were being stabbed by somebody else. This is a close-up of one of the stab wounds. As I mentioned, they're about 3/4 inches apart.
How deep were the stab wounds on Megan's body?
Both of the stab wounds went at least 8 inches deep into the abdominal cavity.
Did you find evidence of hemorrhage?
Actually, on Megan, I did. Inside the abdominal cavity, there was approximately 100 to 200 milliliters of clotted blood in the soft tissue.
What information are you able to ascertain by the soft tissue containing hemorrhage?
So given the state of decomposition and the fact that she actually has some hemorrhage, to me, that indicates that she sustained those injuries antemortem when she was alive.
Absent the other circumstances surrounding Megan's death, would these two stab wounds have been fatal?
No.
Did you also collect samples from Megan's body for toxicology?
Yes. For Megan, I took samples of tissue from the liver as well as brain tissue.
During your examination of the liver, did you observe any abnormalities?
No, I did not.
Did you form an opinion as to the cause of death of Megan Todt?
Cause of death for Megan was homicidal violence of unspecified means in association with diphenhydramine toxicity.
Again, for Megan Todt, were you able to rule out smothering?
No, I was not.
Are your reasons the same as for the reasons you stated for Alec, Tyler, and Zoe?
Yes,
Did you also examine Megan's heart muscle?
I did.
Did you note any abnormalities of the heart?
I did not.
I have no further questions at this time.
Mr.
Thank you, Your Honor.
Cross-examination.
Hello again, Dr. Nair. We last met, I think, in August of last year.
Yes, with the late Mr. Schmier.
One of your sources of information in the case was the detective, Cole Miller. Do you remember that?
Yes, I do.
Had you taken information from Mr. Miller previously? Did you know him?
We worked on a previous homicide case together.
When you first talked to Detective Miller, he told you that this was a case of suffocation or strangulation, didn't he?
He mentioned a suffocation. I don't recall the strangulation.
Do you recall your response when you were asked there what you were told by Detective Miller?
Vaguely I do.
Would you like to review the deposition to refresh your recollection on that matter?
I would.
I'm talking about page 26, the question at line 12.
Line 12, yes. That he supposedly had strangled us for asphyxiated the children. Yes.
Did Mr. Miller also tell you that there was a suicide note or that it was a suicide pact?
Detective Miller did state that.
Help us understand how Benadryl becomes toxic. It is somewhat a benign over-the-counter drug, correct?
Sure.
What's the mechanism that makes diphenhydramine potentially toxic or fatal?
Like with most medications, if you take it in therapeutic levels as prescribed or as recommended on the label, you should be fine. However, a lot of medications, including Benadryl, if you take it at higher doses, Benadryl, you could have some cardiac toxicity, and these are at more toxic levels, especially in children who are affected more easily by doses of medication.
In your career so far of over 4,000 autopsies, have you analyzed or been involved in the medical investigation of Benadryl deaths?
Yes, I have.
About how frequently does that occur
Oh,
in your experience?
Yeah, probably maybe like a dozen. They were all suicide-related deaths, just because it's not very common, just because people will choose other medications, such as narcotics, so we don't see it a lot.
Did you pursue the investigation of suffocation on the bodies?
When I performed the autopsy, I looked for any evidence of suffocation as best I could, given the state of decomposition.
Is it an amylase test that'll test for saliva presence on a pillow or a blanket or a spread that might have been held over somebody's face to suffocate? Was that testing done?
No, that testing was not done.
And then as far as the purpose of strangulation, did you consider that?
Yes, I did. When we think of a suffocation or asphyxial type death, I'd look for petechial hemorrhages inside the eyes, inside the conjunctiva around the eyes, as well as on the skin of the face.
And in a strangulation case, would there be cardiac injury, damage that would be visible?
If you are strangled and you're no longer able to breathe, yes, your heart will stop.
So you've eliminated suffocation and strangulation in the cases that we've discussed here today that are subject of this prosecution, correct?
Objection, misstatement of facts.
I did not rule it out. Just given the state of decomposition, I could not tell if they were suffocated or strangled.
In your experience in the different locations that you practiced, was there a prevalence of knife wounds in any community perhaps where you had experience with a lot of knife wounds?
Knife wounds?
Knife wounds?
Correct.
Correct. And are there patterns or indicators that are important to the medical examiner, such as the depth of the wound?
Yes.
What about a Y-shaped incision or an L-shaped incision? Do those have meanings to you?
When you say the Y-shaped incision, just so the jury understands, I was talking about the Y-shaped incision when we do the autopsy, but you're referring to the Y-shaped incision made by a knife. Is that correct?
Correct.
Yes, we do look for those kind of patterns.
Is that a sign of a heavy thrusting or a more aggravated attack?
No, not necessarily.
And does the L-shaped incision have any importance to you?
When we see instead of just like a straight stab wound, but like an L-shaped, that indicates either the person doing the stabbing moves the knife or the person being stabbed moves their body.
And neither of those were present in the cases that you examined in this case, correct?
That's correct.
The liver and the brain were good repositories of evidence in this case, correct?
For toxicology purposes, yes.
Right. The toxicology even allowed the examiner to find that there was a lot of ethanol in the brain of Megan, is that correct?
There was some ethanol.
And so that means that she was consuming alcohol before she expired, correct?
For her case, according to the toxicologist, she believed there was some alcohol consumption.
Do you know the quantity?
I do not.
When you mentioned that the cases are assumed to be homicides, that just means that a human was involved, correct?
Human.
Tell us what your definition is of a homicide.
Sure. When we refer to homicide, that's a definition that we use as medical examiners. We're referring to violence, a volitional act that's inflicted by another person.
So if a tree fell in the forest and killed someone, that wouldn't be a homicide.
That would not.
But if an angry lumberjack cut a tree down to fall and hit someone on purpose, that would be a homicide.
Correct.
Just the different activity of a human being involved.
Correct.
Doesn't mean premeditation, doesn't mean with a weapon. It has its own definition that we've discussed here, correct?
As I mentioned, it's a volitional act. It does not mean there was any intent.
Were you able to determine whether the knife wound that was observed on Megan Todt's torso was inflicted by her?
Based on the autopsy, I was not able to determine whether she inflicted it herself or whether it was inflicted on her.
If there was a knife wound suicide attempt or a person trying to kill themselves, is there anything distinctive about the anticipated wound or the area where the person would stab themselves?
When I'm looking at a potential suicide by stabbing, I will look at the area on the body, and is this something they could have done themselves? The stab wound, let's say, was high up in the back where someone couldn't really reach it in order to stab themselves. That would be very suspicious.
And also in our discussion back in August, you said that there was no trauma that was associated with the struggle that you found in the case.
There was no trauma that I observed, correct.
Thank you. Did you incise the lip tissue on any of these decedents to determine whether they had injuries to their mouth?
If I saw any areas that I suspected there was injury inside the lip mucosa, I would have cut into it. I just pretty much peeled the mucosa back just so I could examine them carefully.
Was that found on any of the decedents that you examined in this case?
No,
So you did not see any incised or trauma to the interior of the mouth?
I did not.
And that usually comes from being punching, hit, or pressed too hard, correct?
Or smothered with a pillow.
Which we didn't have in the case.
We did not.
Thank you. May I have a moment, please?
Redirect?
Based upon the state of the bodies, were you able to make any estimate as to a time of death, a date of death?
Oh, given the state of decomposition, I cannot give an exact date of death, but given the skin discoloration, the skin slip, the fact that the bodies were all loaded, that's considered what we call early putrefactive decomposition. So it's consistent with being deceased for at least a couple of weeks.
We've used a couple different terms. We've used strangulation, smothering, asphyxiation. Do all of those terms have different meanings to you?
Yes,
What do they mean to you?
there are different forms of asphyxiation.
The stab wounds that you observed in Megan Todt, you indicated that there was evidence that those occurred prior to her death. Would those stab wounds, based upon their location and your knowledge of the autopsy, have affected her ability to defend herself?
Let's see, the stab wound she sustained to her abdomen, she had 2. Although they didn't hit any organs, she did have some bleeding after she sustained those wounds. I mean, anyone sustaining a stab wound would make them, be in pain and not be at 100% in defending themselves.
You talked a little bit about the possibility of a stab wound being in a Y shape or an L shape based upon an individual moving or how aggressive a knife was thrust into their body. Is that right?
Based upon whether the individual being stabbed moved or whether the person doing the stabbing moved the knife around.
If the person that was stabbed could not move, is it possible that the stab wound would not have been in a Y or an L shape?
That's true.
I have no further questions.
Thank you. Dr. Naras, step down.